This is Coach PDHPE with a Core 2 video, Children and Young Athletes. You can find more Year 12 PDHPE videos and other information at Coach PDHPE or on Twitter at Coach PDHPE. This is a Sports Medicine Option 3, Children and Young Athletes. There are 4 dash points and I'll get to these later, but first an overview of the dot point. The dot point, Children and Young Athletes. Children have different physiological issues to adults, and when it comes to participating in physical activity. Children cannot perform at the same high intensity in training as adults do without having a higher risk of injury. Certain medical conditions such as asthma should not prevent children from participating in physical activity if they're managed correctly. And most importantly, physical activity is extremely beneficial for children and should be encouraged even if they have one of the medical conditions listed in this dot point. First dash point is medical conditions, and it lists 3 examples: asthma, diabetes and epilepsy. So let's start off with asthma. 1 in 10 Australian children suffer from asthma, and in extreme cases an asthma attack can be life-threatening. Because of this fact, many parents are reluctant to let their children participate in physical activity, and that's understandable. During an asthma attack, the airways narrow, making it difficult to breathe, and if the individual is not treated with their medication, it is potentially life-threatening. Exercise can induce asthma, and this is known as exercise-induced asthma. Risk is heightened when exercise is undertaken in colder temperatures with low humidity. Being active is an important part of life. A well-thought-out asthma plan means that asthma sufferers shouldn't have to stop or restrict any sporting activities, and exercise can actually help control their asthma and reduce the amount of medication sufferers need. Symptoms of asthma include coughing, tightness in the chest, feeling short of breath and wheezing. If symptoms do not improve within 10 minutes of resting and cooling down, then the young person may have exercise-induced asthma. So how should exercise-induced asthma be managed? It is usually easily managed, and many well-known athletes have managed their asthma to allow them to successfully compete in their chosen sport at elite levels. If asthma is well controlled with preventive medication, the individual may not experience symptoms during or after exercise. So some easy tips. Have a warm-up before exercise reduces the risk of developing exercise-induced asthma. The blue reliever medication can be very effective if taken 5 to 10 minutes before exercising. And the asthma sufferer should always have their reliever medication available. And cooling down after exercise is also important. If they develop asthma symptoms while exercising, it's important that they stop exercising immediately and start their asthma first aid action plan. In summary, that is 4 puffs from a reliever with 4 breaths after each puff. Wait 4 minutes and then repeat the process. If no improvement, then call the emergency services. Swimming and asthma. Swimming is one of the best forms of exercise for children with asthma, as it's less likely to cause asthma symptoms. This is because when you're swimming, you are breathing in air near the surface of the water that is warmer and more humid, that's moist, than the normal air. So we'll move to diabetes. There are 2 types of diabetes, type 1 and type 2. With this dash point, you need to focus on type 1 as it's also known as childhood diabetes. In type 1 diabetes, the pancreas is a large gland behind the stomach that stops making insulin. Without insulin, the body's cells cannot turn glucose, that's sugar, into energy. Without insulin, the body burns its own fats as a substitute. And unless treated with daily injections of insulin, people with type 1 diabetes accumulate dangerous chemical substances in their blood from the burning of fat. This can cause a condition known as ketoacidosis. This condition is potentially life-threatening if not treated. Hypoglycemia, also known as hypo or low blood glucose levels, is when the blood glucose level has dropped too low and can result in unconsciousness. It's important to give the child a quick-acting carbohydrate if they are conscious that is easy to them to consume. For example, some soft drink, not diet soft drink, or a handful of jelly beans or other lollies. Symptoms of hypoglycemia can vary from person to person. However, some common feelings they experience are trembling or shaking, headaches and dizziness, and numbness around the lips and fingers. Hyperglycemia means high blood sugar levels. This can develop over many hours or days. Many people do not experience the symptoms of hyperglycemia until their blood sugar levels are already dangerously high. Although their blood contains too much sugar, they cannot tell unless they do a finger prick test. Some symptoms of hyperglycemia. They feel excessively thirsty, they feel tired with blurred vision, and long term they may experience weight loss. Again, just like for asthma, physical activity helps insulin to work better for children with type 1 diabetes, so it may help to improve their overall diabetes management. Physical activity usually lowers blood glucose levels due to the muscles using more glucose as energy. Physical activity increases blood glucose levels due to the effect of other hormones on the body, usually temporary due to the stress or excitement. Children with type 1 diabetes should be encouraged to be active and plan ahead. Test the child's blood glucose levels to decide how much extra carbohydrate may be needed before the activity starts. Think about how long the activity will last and how active the child will be. Prolonged periods of activity may require extra carbohydrates or a reduction in insulin dose. Make sure the child carries a hypo kit with them, e.g. some juice and biscuits when they're exercising. And finally, make sure the child is supervised or exercises with someone who can help in case of a hypo attack. Epilepsy. People with epilepsy and their families are commonly concerned about seizures during exercise. Fear often results in overprotection and needless activity restrictions. So an understanding of how exercise affects both epilepsy and seizures is really important. Seizures during exercise are rare. If seizures do occur, it is most likely after the exercise has happened, some 15 minutes later. Very occasionally, people can have seizures that are triggered by exercise during the activity. Overall fitness and a feeling of well-being have been shown to help reduce seizure frequencies. People feel better and improve their seizure control with regular exercise. So for tips when playing sport, it's important obviously to stay away from water activities unless they are fully supervised. In playing contact sports, it's important to wear the right protection such as headgear. The coach and possibly teammates should be aware of players who have epilepsy. Ensure the child is well hydrated and drink or snack on something with sugar in it. And finally, don't continue exercising if the child begins to feel faint, lightheaded, nauseous or dehydrated. Overuse injuries, including stress fractures. Overuse injuries are on the increase in children due to the effect of the increasing pressure from parents to perform and having more activity options available. It's quite common these days for kids to be exercising in one sport or another many days of the week. When activities such as running are done at a young age, too much stress is placed on muscles, joints and tendons. If not enough recovery time for the body to heal is given, then the chances of overuse injuries increases significantly. Some examples of overuse injuries include shin splints, stress fractures and tennis elbow. Tips to avoid overuse injuries. As young athletes' bodies grow, it's essential to allow the body time to recover. Allowing young athletes to participate in numerous sports also allows different muscles to be used, reducing the risk of overuse. And a closer look at the injury stress fractures. They are caused by repeated stress on a body part, such as continual running. For stress fractures, coaches should teach correct technique, including cross-training, also buying the correct equipment, give adequate rest breaks between training sessions. Thermoregulation. Since many young athletes practice and play sports all year in extreme weather conditions, their ability to control their body temperature, called thermoregulation, is critical to avoiding heat illness or hypothermia. In Australia, the reality is that hot conditions are more crucial to address. Children and young athletes are at higher risk of heat illnesses as they are not as efficient at regulating body temperatures as adults are. Young athletes have Young athletes take longer to sweat due to immature sweat glands, therefore holding in the heat longer. They become dehydrated very quickly as their body temperature increases faster than adults. It is therefore absolutely essential that coaches consider these factors when training children and in young athletes in hot weather. As a rule, children and young athletes should not participate in physical activity if it exceeds 34 degrees. Strategies to prevent the risk of heat illnesses in young athletes include train with access to shaded areas to cater for rest breaks, give regular drink breaks, appropriate clothing to be worn in both hot and cold conditions, and avoid vigorous activity in extreme conditions. Finally, resistance training. There has been much debate about whether weights or resistance training is appropriate for young people. The current position on youth resistance training is that if it's properly designed and supervised and the training program is safe, it can help to increase strength, prevent injury, and enhance performance. An athlete's emotional well-being can be enhanced through resistance training also, via improvements in self-esteem and body image. It can just also improve general health, such as leading to the reduced risk of cardiovascular disease and diabetes later in life. But perhaps the most important factor to designing a resistance training program is this term individualisation. Sports trainers should take the time to evaluate each child's body type, take into account prior experience and the individual goals of the athlete and what sport they are training for. A child should avoid doing any resistance training using heavy weights until they reach puberty, otherwise long-term skeletal abnormalities can result. Initially, young athletes should use their own body weight for resistance training. Exercises such as push-ups, chin-ups and abdominal exercises where the young athlete can use their own body weight can provide a good foundation for further weight training. When moving on to using actual weights, it's important to start with light weights with high repetitions. Increasing the number of sets performed and the number of exercises in the workout will enable strength development. Over time, the size and type of weights can be changed to further develop overall strength. Thanks for listening.